Hello, I'm Dr. Laura Murillo, President and CEO of the Houston Hispanic Chamber of Commerce. We're going to have a very interesting conversation with a variety of guests today to talk to us about COVID, vaccinations, and making sure we remain safe. Among our guests, we include our Board of Directors, David Titus. I'm going to go ahead and start with him so he can give us a welcome on behalf of our Chamber Board and our Foundation. David Titus.
Good morning, everyone. Hi, I'm a member of the Foundation Board for the Houston Hispanic Chamber of Commerce and was a prior member of the actual Board of Directors. We want to welcome everyone to our discussion today about COVID resources in the greater Houston community.
Thank you so much, David. You've been an integral part of our community and have spent many, many years in the Texas Medical Center, so we thought it was appropriate to have you join us on this call. Thank you for your service to the Chamber and now to our Greater Houston Hispanic Chamber of Commerce Foundation. Also joining us on today's call is Dr. David Pearce. He's the Chief Medical Officer for the City of Houston. And the two individuals you see on the screen are Assistant Fire Chief Roy Lozano and our Fire Chief Sam Peña. Thank you all for joining us as well. We'll get to some questions in just a minute. From Harris County is Sherry Oniego, who's joining us. And also, again, thank you all for being with us. Our friends over at the University of Houston, congratulations to them for the establishment of their College of Medicine. And that is none other than Dr. Stephen Spann, who is the founding dean for the School of Medicine at the University of Houston. Welcome to all. We've got a lot to talk about, so let's go ahead and get started. I'd like to begin with our friend over at the University of Houston, Dr. Spann. I've had the pleasure to serve on the advisory board with you and others, as this was just something in Dr. Couture's mind and many of those at the University of Houston, to see it in fruition and the impact that it has and will have for years to come is certainly very important to our region. But specifically, Dr. Spann, I'd love to hear more from you in terms of COVID, what you're seeing specifically in the Houston region, and what conversations you want to have as it relates to minority communities. So thank you for joining us, Dr. Spann.
Well, thank you, Dr. Maria. It's a pleasure to be with you. We, of course, are seeing the full impact of the COVID-19 pandemic here at our University of Houston campus. Most of our classes are taking place online, although about 18% are going on in person. We've done fairly well on our campus. The rate of COVID infection here is only about 20% of what is reported at a state or a county level. And so our students, faculty, and staff have been following the public health recommendations, I think, and doing a good job of preventing this transmission on campus. We are hopeful that we may be beginning to see a flattening of the curve, at least at a national level. The last few days, the number of new cases confirmed have been a little lower. That was the case in the state until yesterday when we had another bump of over 20,000 cases. But we're hopeful that now, having gotten through the holidays, we will begin to see a flattening of the curve in terms of new cases. I think we're all excited about the vaccine and the opportunity to begin to immunize our community to prevent symptomatic COVID infection. Of course, there are a lot of challenges around distribution and supply, but we are hopeful that this vaccine is going to make a significant impact on the new cases and ultimately help us control this pandemic.
Well, and we look forward to our continued relationship with you all, and also co-authoring some white papers as it relates to some specific disparities among our minority communities. And so thank you for all that you are doing, and we wish to continue that dialogue. As you all on this call especially know, that minority communities not only have been hit disproportionately, but now as we're looking to vaccines, also there are some concerns among community leaders that some of the minority communities may not be as willing to go out and get the vaccine. And then, of course, the whole conversation around distribution and receiving those vaccines. On that note, I'd like to now ask that the City of Houston and Dr. Peirce, if you'll talk to us a little bit more. I know you guys began the rollout over at Minute Maid. We're seeing the hospitals over at NRG. Give us some hope that the vaccine will be distributed to our city in a very quick fashion as soon as those vaccines are ready.
So first of all, let me say thanks for having me on board and for putting this together for everyone, because getting information out is so important for everyone to have an understanding. And there's a lot of anxiety in the community. So let me talk a little bit about the vaccine. The decision as to who gets how much is really made at the federal and the state level. And the shipments actually come directly from the manufacturer. So we've had talk about, how the federal government decides how much each state gets. Each state then decides which vaccine provider will get how much. And sometimes people translate it in their mind into, there's this giant warehouse in Austin just full of vaccine, and why don't they let it out? And that's not a reality. It actually comes directly from the manufacturer. And so we're limited at this point really by how much the manufacturers can create vaccine. So they were making vaccine and sort of stockpiling it a little bit before the emergency use authorizations came out. And so that's what we're seeing now, is that vaccine coming out. And so a couple of things to keep in mind. This gets a little tricky. So we're trying to get vaccine out into people with the 1A and the 1B prioritizations. And then remember, after they get vaccinated for the Pfizer, 3 weeks later, they need to get their second dose. And with the Moderna, it's 4 weeks later, they have to get their second dose. So the logistics quite quickly become very complicated when you have a limited amount of vaccine coming in to make sure that you not only have stuff to continue vaccinating people the first time, but also the second time. And so a lot of the confusion that you've seen is surrounded that. And so I will say unequivocally, I have not found a bad actor in any of this. It is just really, really complicated. And the amount of vaccine that's been coming locally has not been the same amount week on week. And so as the amount of vaccines coming in fluctuates up and down a little bit, we need to adjust with that. And that's made it challenging. And for some people, unfortunately, it's made it frustrating. But
yes, but we've encouraged them to continue monitoring the city's website, visiting with their doctors, the county, et cetera. So don't give up if you're watching. Continue to stay informed and continue to make sure that even once you've had that first dose and certainly that second one, as our fire chief has indicated to many folks, you must continue to practice social distancing, wear your mask, et cetera. I'd like to turn now to Harris County. And Doctor, tell us a little bit about what we're seeing at Harris County, what hope you have for us as it relates to the county receiving vaccines. We know that Fort Bend and other areas have also been very engaged with all of this. What update do you have for us from Harris County, Doctor?
Well, thank you, Dr. Maria, for having us and for the Houston Hispanic Chamber of Commerce for putting this event on. We're always very happy to talk and to really provide updates on where our efforts are throughout this entire pandemic. We've certainly been responding to multiple facets of the pandemic, from contact tracing, case investigation, community testing, and now vaccinations. And so, as Dr. Peirce mentioned, there is certainly a stair step or sort of a layered approach with how that vaccine is disseminated and distributed and how it ends up into the hands of the local health departments. And so we are really staying in close communication with our state partners. As you know, and as you mentioned, there have been a number of local health departments and as well as local entities who've been deemed as these hub providers. And that really is a way to ensure that we're able to vaccinate as many people in our community as possible in an efficient time frame. And so as we sort of work through the logistical challenges and sort of not only the logistical challenges, but also the supply challenges, because we know that right now that's where our sort of deficits and that's where our sort of problem spot is that the supply just is not enough to meet the demand. But we are certainly encouraged as more science continues to evolve, more vaccines become available, more vaccine platforms are developed and approved, that we will be able to provide more to the general population.
So on that note, it's our understanding from the new administration that we are hopeful that we will have over 100 million within 100 days. The question for both the city and the county is, what things are you all doing to prepare for the logistical component upon receipt of more vaccines?
So with the city, we've done the mega sites, and you saw on Saturday we did just short of 7,000 people. So we're going to be shifting to multiple sites doing smaller amounts, and that'll be occurring this week. But again, it's really totally dependent on how much vaccine we get in. And the good news is that we just this morning, Dr. Niego hosted a conference call with some people from the state who anticipate that in the coming weeks to months, we should see a significant, don't know what that means, but a significant increase in the amount of vaccine coming to the state. But for right now, in the next several weeks to a month or two, it's probably going to remain relatively constant what we're getting now. But we're going to try to diversify and spread out our vaccine administration sites.
Yes, and I know that in conversations with some of our nonprofit organizations, such as the YMCA and others, which are trusted resources in our community with locations throughout the greater region, these are trusted entities. They have volunteers. They have a lot of the things that are going to be needed as more vaccines become available, working with our insurance partners, et cetera. And so again, to those of you who are watching, stay tuned. Make sure you're looking and connecting with your doctors, but more vaccine on the way. And again, hopefully more locations, more sites. The conversation has been, especially again, among minority communities, of going where those communities are and not expecting them to go to places that they may not be familiar with. And of course, that the language opportunities are there, because I know that there's paperwork involved and a lot of processes that are very important. So let's talk about the city and some of the things that you all are doing to put in place volunteers for people who perhaps do not speak English and, as a matter of fact, may not even be able to write or read. What types of volunteer opportunities do you have? What do you already have in place?
So from the city standpoint, and Dr. Niego, I think, has similar things with the county. You know, in public health, we've been dealing with the same, the communities of color, the communities of different languages, over a variety of things, whether it be measles vaccinations or eyewear for children. And so we've got great relationships with a number of entities in those communities that are language and culture sensitive. So we're going to be leveraging those as we get more vaccine in those current partners, so that we can address the issues that you're talking about right there.
And from the county perspective, Doctor?
Yes. So I would just echo what Dr. Person said. One of the other things that we've really valued quite often throughout this entire response, and even before the response, we know that they're what we call the social determinants of health. I mean, health begins where not only in the four walls of a traditional clinic or a hospital space, but really where people live, where they learn, where they work, where they worship, and where they play. And so we have always had a very strong passion and strong belief system in outreach, education, and engagement. And so throughout this entire pandemic and throughout our response as an agency, we've had those outreach opportunities where we have outreach staff and outreach workers that are going into the communities, that are really boots on the ground, if you will, educating the community, whether it's about the virus itself, whether it's about how to get tested, where to get tested, ensuring that the information is available in multiple different languages. And then also to kind of go back to your earlier point where we were talking about leveraging a lot of the community-based organizations that are also trusted partners in those communities, to utilize them as these spokespersons or as their to amplify the voice, to amplify the message. We're also looking to do something very similar with the federally qualified health centers as well, even when it comes to increasing that vaccination dissemination as well. So very similar, utilizing the existing structures that are in place that people already trust.
Yes, and we were on a call earlier today interviewing Congresswoman Lizzie Fletcher, talking about the delegation in Washington that represents us, encouraging them to do all that they can to get us more vaccines and, of course, more financial resources for our small business through the PPP loan and other. And so your chamber is out there advocating, as it always has, to make sure resources come to our community. Speaking of boots on the ground, I want to now turn to our fire department, and welcome to both of you. Thank you for joining us.
Thank you, Dr. Murillo. I'm honored to be here. We're honored to be here with you and a distinguished panel. And I'm here with my right-hand man, Assistant Chief Lozano. And this is an important conversation. I think getting the information out to our community as far as what we're trying to do to ensure the safety of our community. We talked about the availability of the vaccine, which we're receiving some help, and we're hopeful that we're going to get the right amount. The second thing is the distribution, and as the doctors have mentioned, more and more sites are becoming available, and eventually we'll have the distribution network set up to where it's easy for people to get it. But third, and most importantly, and thank you and the Chamber for what you're doing in getting this message out, is the communication about the safety and the efficacy of this vaccine. It's important. That is going to be the key to get the traffic that we need to get vaccinated, is us, programs like yours, getting the information out to our communities. This vaccine is safe. The science is solid, and I don't think there's anything to fear from this vaccine. And the more we get that message out, the more our communities are going to be engaged and willing to take this vaccine, which is going to help us all.
Well, and I know that unfortunately, people have become frustrated. They have decided to be out in public without their mask, visiting relatives on a regular basis. You can see homes with 10, 15 cars parked outside. Chief Lozano, from your perspective, what are some of the things that you want to make sure to communicate to the businesses that are exceeding capacity, to the constituents of the city who just quite frankly have just decided they're going to do whatever it is that they want, and so be it with COVID?
Well, I think the most important thing in this particular case, if you witness what we would consider an unsafe environment, report it. And that, Chief Peña has a strong team of occupancy enforcement that goes out, and we go out not to try to close down businesses, but to try to work with businesses to ensure compliance to the governor's orders. That is key. But the second thing that I want to reiterate, early on when COVID started, there was a huge shortage of masks, gowns, and PPE that was needed to protect first responders. I want to thank Chief Peña, the Chamber. We made a lot of great relationships, and it took relationships to ensure that the supply chains were reestablished and that all our frontline workers are protected.
Yes, and so many of our Chamber members, including our chairman, Arnold Gasita, turned his petrol oil from a lubricant company to producing the hand sanitizer, the mask, etc. And it's that innovative spirit and entrepreneurial spirit of Houston and our Chamber members that, again, has helped our community move forward. Unfortunately, though, I know there's still a lot of people who perhaps are not wearing masks, businesses who are trying to stay open, trying to be creative. Let's give credit where it is due. Many of them have put their tables outside. They've invested in money to spread out. And hopefully the sooner that we can continue to get those vaccines and practice safety, the better off we'll be. And it is about partnerships. And specifically with the Houston Fire Department, I know, Chief Peña, you and I had many conversations of engaging our corporate partners to invest and support not only the Houston Fire Department, but the police department and overall the city of Houston and the county. And it was very nice to hear from you all regarding one of our corporate partners over at Enterprise. And they have the rentals that are at the airports and throughout the city. Our friends Dan and others there visited with you all. Tell us briefly some good news there that resulted as an introduction from the Chamber and some cost savings for the city of over $2 million.
Sure. Before I get into that, because that is big news, I just want to reiterate something that you said, and that it seems like our community is a little battle fatigued. They're getting tired of all these lockdowns, of all the things that we're trying to do to keep the community safe. But it's critically important that, especially at this time, with the help that's on the way, the pipeline has been established, we're going to get vaccines out, that we practice just the basic recommendations. Keep wearing your masks. Proper distancing and proper hygiene is going to go a long way to ensuring that we overcome this pandemic and these lockdowns as quickly as possible. But to your point, Dr. Murillo, and it's to your credit because you introduced us to Enterprise, the CEO of Enterprise Rent-A-Car, almost 3 years ago, right, in 2018. And through that introduction, I'm happy to report that, and Chief Lozano was instrumental in this help. And he's a graduate of the Rice Executive MBA program. And we put that MBA to work because what we were able to do is we're moving away from the outright procurement of vehicles that need to be replaced on a certain cycle. And we're moving towards a lease purchase program. And, we structured it in a way that's going to be very cost effective. Our firefighters are going to be working with efficient, safe equipment every single year. And it's going to be a cost avoidance, a reduction in expenditure of almost $2 million in the length of the program, which is huge. I think that's the proper way of using our taxpayers' money. It's an efficient way of providing the business that we need. And it's an efficient way to provide our firefighters the tools and the equipment to safely do their job. So, leveraging the private sector is I think the way we should be looking at delivering government service. And I want to thank Enterprise Rent-A-Car. I want to thank you, Dr. Murillo, for making that introduction, because without that, I think we would have still been spinning our wheels trying to replace these aging apparatus. So we're rolling it out. We're going to get our first batch of vehicles in March. And we're going to be replacing 105 to start the program. And eventually that program will grow to where we are putting all our light duty vehicles on this program. And it's going to be a huge cost savings for the taxpayer of the city of Houston.
Well, thank you for sharing that, and thank you for your leadership, and also always being so engaged with our chamber and connecting those dots. And so we truly appreciate that. I want to go back now to Dr. Span before we wrap up our program. Tell us a little bit more about, some folks may not know, the role that the University of Houston and the College of Medicine is playing as it relates to COVID before we wrap up the show.
We are very interested in finding ways to work with our communities to improve testing, to improve vaccine distribution, and also to work on finding ways to improve some of the mental health effects from COVID-19. In fact, we're planning a virtual summit coming up in about a month with folks from around the community to come and talk about that, how we might partner together to improve these issues. Specifically around vaccine, we have a federally qualified health center here on campus. We hope that that will be a point of distribution for the vaccine. We have health profession students in a number of professions such as nursing, medicine, pharmacy, optometry, students who can contribute on a voluntary basis to immunizing individuals, and we hope to contribute volunteer effort to that effect. I think importantly, to be a part of the educational efforts for our communities so that people understand the benefits of vaccination, the relatively small risks and side effects, and the fact that if we can vaccinate enough of our population, that will really help us get out from under this pandemic.
Yes, and so please, if you've not obtained information about the vaccine, and remember there are different types of vaccines. I know that we received a lot of questions from individuals who are wanting to know whether or not they have to get that second dosage from the same manufacturer. We know that answer is yes, but other vaccines are being released. And so do your homework, get information, contact your doctors, but just know that we must continue, even once we are vaccinated, to wear our mask. We know you are tired, but we know that this is the saving grace for our community, for our country, and for the world, quite frankly. And so just know that your Houston Hispanic Chamber of Commerce is advocating for you every day at the congressional level, at the state level, and the local level to provide you with information and everything that you'll need to get back into business, to get back to work. We're having an entire conversation later today with school leadership, including individuals from the New York system, what they have done, what's going on in the Valley, what's going on here in Houston, because we know there's so many complexities to getting through COVID, including what's going on at our schools. And So your Houston Hispanic Chamber of Commerce is here to provide you with that information. I'd like to thank our board of directors, including Mr. David Titus, who serves on our foundation. We can't do this without them. And of course, the great staff at the chamber. My thanks to all of the guests for all you are doing, for the sacrifices that you are making and that your families are going through as well. Thank you once again. And on behalf of our Chamber of Commerce, we hope to see you on the next program. I'm Dr. Laura Murillo. Have a great day. Goodbye.